Jacque noticed he hasn't been invited back to clinics, but wasn't sure why. Until a peer, Anita, mentioned she had seen several of his former patients and encountered some concerns. She shared that it was difficult to follow what had happened during his appointments due to his limited record keeping. And in several cases, there was calculus left behind that had prevented the tissues from healing properly. In one instance, a patient called the clinic a week after their cleaning, claiming they developed a really sore lesion in an area Jacque had scaled. When the clinic investigated, they discovered Jacque didn't document a soft tissue exam. When asked, Jacque couldn't recall specific details or where in the mouth he scaled. This is a tricky situation for the clinic. Without clear records, the clinic wasn't sure whether the lesion predated the appointment or whether a specialist referral was needed. Jacque has been feeling pressured to finish appointments on time and knows he's been having a hard time completing his assessments. Because of this, his documentation has been minimal, and he feels too rushed to fit in an intra and extra oral exam. Until now, he hasn't had any feedback about his performance and the impact of his documentation on continuity of care, but he's glad he knows now. In his current continuing competence cycle, he completed CPR and a water-pick lunch and learn. He chose these because he figured his knowledge from school was still fresh, and he just needed something convenient.